The purpose of this video is to apply a static postural assessment. Static postural assessment is one of the tools that we use in order to determine any imbalances or potential weaknesses or pain points for the client, and then we use this information along with other tools as PDQ, movement assessment, medical history, and then we use this information together with the client preferences so that we can prescribe an effective exercise program which is most appropriate for the client and for his special needs. If requires, the postural assessment allows us to refer our client to an AHP if there's something wrong or if there are any issues that are out of our scope as PTs. The static postural assessment essentially looks at 5 complexes of the body. The first one is the foot and ankle. The second one is the knees complex. The third one is hips and pelvis. The fourth is the spine and shoulders. And the last one is the head carriage complex. It is very important to note that we need to look at the body through the myofascial lines from a global integrating aspect, where what happens in one body part affects the rest. The static postural assessment is done from the anterior front view, posterior back view, and lateral sides of the body. Before we start, Ofer, can you provide consent for this video?
Yes, I do.
Great, thank you. Do you mind taking off your top?
Yes, I can.
Are you comfortable with that?
Yes.
Thanks. We have a plumb line here. Ofer, could you please get closer? Thank you. What I did is that I lined up Ofer that the plumb line is intersecting the midline of his body, going through his nose, chin, umbilicus, and down his legs. Ofer, please loosen up. Breathe in, breathe out. March on the spot. And please maintain a relaxing position. We'll start with the foot and the ankle complex. What we see with Ofer foot, they're fairly normal, straight ahead with slightly toe out. When we're checking Ofer's arches, we can see that they are flattened, and this is what creates a pronation foot. Going up to his lower leg, we can see that this pronation actually affects his lower leg and creating an internal rotation in his tibia, which actually affects his femur. Going up to the knee complex, we can see again that his knees are coming out from the femur. His knees are coming out from the femur and then coming in the tibia, creating a typical bow-legged and varus knees. All of those relationships and connections between the ankle and the foot, the tibia, the femur, are giving us lots of information when we're going up the kinetic chain, up to the hips and pelvis. The pelvis is a really key point, telling us a lot about what's happening with our client's posture. So the next thing to check in the hips and pelvis is the ASIS, anterior superior iliac spine. So with Ofer's permission, I will touch them. Is that okay, Ofer? Thank you. So I'll get them. Okay. So what we can see here is that the right ASIS of Ofer is a little bit lower than his left one, creating an angle going down from here and this direction. That might tell us that Ofer might have right leg which is shorter than his left one. So we have this angle in the hip and pelvis. Going up in the kinetic chain, we would check now Ofer's shoulders and upper torso. So the first thing to, so the first thing to check is the shoulders position. We want to see if there is rotation happening here in Ofer's shoulders. So in order to determine what's going on with Ofer's shoulder position, we're going to check his carrying angle and the rotation of the humerus. So, yeah, just relax. What we can see on both sides is actually Ofer's first finger and thumb. That tells us that no internal rotation going in with Ofer shoulders, and that's the information for now. Now the next thing to check in the shoulders is any differences in shoulders height. So I'll go around the apex area of Ofer, touching his bone, and again what we can see that his right shoulder is lower than his left shoulder, keeping this angle just as in his ASIS. Again, we have this angle going on in here as well. Another thing that we can see is that the right lower shoulder is depressed and that the left shoulder is elevated. Now, just to reinforce this information, I will recheck Ofer hands position again, and looking at differences in height, we definitely can see that his right hand is a little bit lower than his left hand. The last thing to check is the head carriage, to see if there is any lateral flexion of the head, and checking it with Ofer, we can see that his head is a little bit laterally flexed to the left side of his body from the midline. Okay, now we will check Ofer from the posterior view. Could you please turn around? Okay, now what we want to do is to reinforce the information from the anterior view and maybe find some new information. So the first thing to check again is the foot and ankle complex. We can see that Ofer's heels are standing nice and stable on the ground. Again, we can see that his arches are flattened, pronation fit. Again, the same relationship with the tibia and the femur, creating this bow leg position and varus knees. checking height, the height of the creases. There are no differences, the same height, still the same internal rotation of the lower foot, which makes the femur follow it. The femur is affected by the internal rotation, and then the pelvis would probably be, and this is the next thing to check. So what we're checking in the pelvis, in the posterior view, is the PSIS, which is the posterior superior iliac spine. And with Ofer's permission, I would touch them again. Is that okay, Ofer? Sorry, I didn't ask you to march on the spot when you turned around, and I can see that you're a little bit bent. Could you please, yeah, stand on the spot. Yeah, loosen up. Just keep a relaxing position. Beautiful. So I'm going to touch your the PSIS in your back. All right. So checking differences in height in Ofer's PSIS show us that this time his left PSIS point is lower than his right one, the opposite from the ASIS. I reckon that his body will have to compensate about this curve. Now, looking at Ofer's spine and thorax, we can see that he has a bit of S curve going on. A little bit of scoliosis is going in Ofer's back, and I will definitely refer him into an AHP. What is happening here is that there's a shift happening in his thorax and in his pelvis that creates this S-shape curve. Now, the next thing to check is Ofer's scapula. It's just, again, reinforcement of what we saw before. We can see that his right shoulder is a little bit lower than his left one. Checking last his head carriage complex, again reinforcement of what we saw before. We have his head is laterally rotated to the left side of the body. It's probably to compensate on the fact that his body is shorter in the right side. Okay, Ofer, now we're going to check you from the lateral view, from the right lateral view. Yes, just march on the spot, loosen up, breathe in, breathe out, maintain a relaxing position. Now, Ofer, with your permission, I will move you a little bit because I want your lateral malleus, all your body. I want your body here. What I want is your lateral malleus to be in line with the plumb line. Okay, so the lateral malleus is our reference point, and everything that will be checked in this lateral view would be compared to this point of the body. Ofer, could I just ask you to move a little bit? Yep, that your body won't touch the plumb line. Great. So it means that if anything is forward or backwards comparing to this point, this is our reference point. Again, we're going to start with the foot and ankle complex and going up the kinetic chain, we can see that dorsiflexion is happening in here. And this dorsiflexion makes all of his body actually goes forward. It makes offer going in a forward position. Going up the kinetic chain, checking offer's knee, we can see that there is a forward translation of the knee. Checking his, his knees are a little bit flexed, not hyperextension is happening in here. His patella is tight, a bit of locked knees are happening in here. Now we're going up in the kinetic chain, checking his pelvis. We can see this forward translation of the pelvic. We can actually see an anterior pelvic tilt of offer in order to compensate for the forward translation of his feet, ankle and knee complex. Now his body, in order to compensate for this interior pelvic tilt, actually created here the natural curve that we usually have and made it deeper. So we actually have a bit of lumbar lordosis that is happening in here in order to compensate for the interior pelvis tilt. Offer, could you please just stand up straight? Going up in his spine, checking his thorax, we definitely can see a very marked upper kyphosis that is happening in here, and a lower cervical kyphosis that happens. So offer's kyphosis is actually an upper kyphosis, and it happens in order to compensate for the lumbar lordosis that compensate for the interior pelvic tilt. What else we can see is that there is a little bit of lower cervical extension here in the cervical spine that actually cause a forward head position in offer's posture. Last thing to check here is shoulder and thorax. We can definitely see that offer's shoulder is rounded and forward, and it is just happening, I reckon, because of his very marked kyphosis. Now, Offer, could I please ask you to turn to the other side? Yeah, I want to line you up. Could you? Yeah, I want just a little bit further, please, because I want his lateral malleolus to be in line with the plumb line. What we're going to do with the other side is to compare sides and to reinforce the information that we gathered so far. Offer, please march on the spot. Yeah, natural position, maintain a relaxing position. Let's just see. Yeah, your lateral malleolus is in line with the plumb line. Again, we can see dorsiflexion is happening in here. Because of this dorsiflexion, forward, all his of his body is actually in a forward translation of the knee, of the hips. going up to, actually we can see here again the interior pelvic tilt, and now we can see clearly, Ofer, could you please just stand? Yeah. We can see the lumbar lordosis, and going up his thorax, we can see the very marked kyphosis. And again, kyphosis is an upper kyphosis. We can see it here in his upper thorax and in his lower cervical spine. Again, we can see that a little bit of cervical extension is happening in his cervical spine, which again cause a forward position of the head. Looking lastly at his shoulders, we can definitely see that he has rounded forward shoulders. So again, we can see the compensation that Ofer's body is doing in order to compensate for the abnormalities that are beginning with his dorsiflexion, that brings all his body to a forward translation, interior pelvic tilt, and then lumbar lordosis and upper kyphosis of the thoracic spine and the lower cervical spine.